to explode in the region. Mark Namaswa, KTN News.
So there's been a lot of conversation on the amount of money going towards the COVID response. We are seeing the government trying to marshal all the numbers in terms of monies from corporate world, from government, from world bodies like the World Bank who've donated to the country, even as we race against time to try and contain the COVID-19 pandemic that continues to rage on across the globe. So let's quickly take a look at the number, some of the monies that have been used so far. According to a report there tabled today by the Health Committee Chairperson of the National Assembly, Sabina Chege, will also be taking a look critically at the 1 billion from the World Bank that continues to elicit a lot of reaction, especially from Kenyans. So there's a 300 million shilling that has been used so far by the government through the Ministry of Health that they said they disbursed to various departments in government to just handle a number of things, starting from the Ministry of Foreign Affairs that is said to have been allocated 10 million shillings to facilitate Kenyan students who are in Wuhan. Remember, a number of them have been asking, a lot of them actually have been asking to be brought back home. So 10 million shillings to the Ministry of Foreign Affairs to facilitate the students. Ministry of Defense on preparedness, especially on COVID-19 response, 75 million shillings going to the Ministry of Defense. This is in the 300 million shillings from the report tabled today by the Chairperson of the Health Committee, Sabina Chege, to the National Assembly. The National Youth Service received 10 million shillings for security at their isolation facilities. The Kenyatta National Hospital receiving 150 million shillings for additional bed capacity at the Mbagathi Hospital Isolation Center. We also have the communication and whatnot. Let's just take a look at that. The State Department for Broadcasting and Telecommunication receiving 5 million shillings to facilitate community outreaches and media tours, across the regions, as well as the State Department for Public Works receiving 1.5 million to facilitate completion of construction works, fencing. They're talking about a feeder road into Mbagathi Hospital isolation facility, as one of the things, of course, that will be used up in that 1.5 million shillings. As well, the Ministry of Health receiving 48.5 million shillings to provide medical response and logistics, especially at the isolation and quarantine centers across the country, bringing the total to 300 million that has already been disbursed and used from the various departments in government. So there's also the supplementary budget from various bodies, and we'll be quickly taking a look at this from the government, from the World Bank, from a global fund, from Gavi, another world body. So government 1 billion shillings from the supplementary budget to hire an additional health care workers that will be working until June of 2020. So the World Bank, there was a 1 billion shillings and 2.3 billion that was used on emergency response as well as COVID response support. We'll be critically looking at what we got from a report from Mutahi Kagwe, the Cabinet Secretary, to the to the Committee of Health of the National Assembly on the 1 billion used and how it was broken down by the Ministry. COVID-19 Fund Board didn't get much. Actually nothing. They had requested to fund the PPEs, laboratory and testing and communications, bringing the total of the supplementary budget so far in the COVID-19 response to about 5.4 billion shillings. So the 1 billion shillings that I said we would later take a look at, that has elicited a lot of reaction on social media and beyond among Kenyans. Leasing of 15 ambulances put up at 42 million shillings. Many have asked, do we still not have this? We've seen county governments procuring this over the years. We'll be speaking to an economist to just take a look at these numbers. Healthcare workers, quarantining of healthcare workers for about 90 days. The budget was approved for 13.5 million shillings. So far, 12 million shillings has been used up. Airtime for 500 staff for about a period of time. 6 million shillings was approved so far. 2 million shillings has been used up for airtime for workers. Fuel and maintenance of the vehicles as well. We're seeing stationary. 6.5 million has been used. Communication, get this, 70 million shillings has been used so far on communications. A lot of questions coming. That's a blanket statement. Can we have it broken down? Call centers, 11.8%. There was a mistake here. It was approved at 900,000, but from that report we see 9 million shillings has been used on printing of forms for those in quarantine and whatnot. Let's speak to economist Kwame Owino, as well as from the Institute of IEA, to just take a look at how are we faring so far. It's been more than a month since we reported our first coronavirus case. We're heading into 2 months. We are seeing the numbers being floated around by the government as what has been used so far. A lot of reactions from Kenyans on 1, transparency, 2, are we spending in the priority areas? What do you think, Kwame?
Well, I think, okay, thanks a lot, Akisa. I think the numbers that have been released have a problem with transparency, as you stated, because they are block numbers. So when we say we leased 15 ambulances for 42 million, I mean, that raises a question of, okay, how much are we paying per day, or how much does it cost? So I looked very, very quickly at what it costs to actually have a fully kitted ambulance at the recommendation of the NHS in the UK. And I found out that an ambulance, a top-notch ambulance, is about 10 million Kenyan shillings. Now, our figures here suggest that you're paying 2.8 million for 48 days for each ambulance, which means that you'd be able to acquire, like you'd have bought the one third of that ambulance based on this. So maybe those are the costs, but it's suggesting to me that I think the government is paying for, overpaying for some things, which might not necessarily reflect corruption, but it reflects the looseness of procurement in government and its inability to do well. I think it also raises a second question about airtime for staff. 500 staff, well, perhaps they're the staff who are managing the call centers. Yeah. Maybe so, maybe not. But you see that there's separate costs for call centers somewhere else. And I'm wondering why it needs to be in this form. I think it's very, very possible to actually have contractual agreements with the service providers and ensure that these people have that facility without, because what it looks like is like you're portioning for each of them some amounts. Printing costs, as you can tell, there was an error on the reports. I'm not too sure whether it's 900 or 9 million, because on one side it says 900 was approved, and then it says 9 million was used. So I suspect this was partly because of the nature. I mean, this was an emergency, so the report was prepared very quickly. But 9 million worth of printing would be extremely, it would be a lot, but at the same time, government has done quite a bit of brochures and stuff. Information kits and all that. So it's possible, if it's for the whole country, then it's possible that you could spend 9 million.
This figures, yes, just quickly, just finish.
Then I look at something on stationery printing, toners and papers for 2.5 million approved, but already the expenditure is 6.5 million. So it's all above what the figures would be. So once again, on the one side, it's the printing of travelers' forms, and the other, it's stationery and printing and paper. 6.5 million over. Again, 48 days today in our account since the first case was announced is quite a bit of printing. But then I think the only thing that's not here that we ask for is basically detail. So let me talk about fuel and maintenance of estimated 30 vehicles. Now, if you're paying for fuel and maintenance of a vehicle, 40,000 shillings per week, right? And fuel right now is just about, premium fuel is right now about 100 shillings. That means you're buying 4,000 liters. 400 liters of fuel per week, which means that you're filling your tank 6 times, or filling the tank every day for the whole week, basically. A full tank every day for the whole week. Now, when you have a car that is filled with fuel, it means these vehicles are traveling close to 1,000 kilometers per day. I'm not too sure if that's what it's meant, but from these numbers, it's telling us that there are some very gross figures that we are spending too much money on.
Back to that question, are we spending on the priority areas? We are dealing with a pandemic. A lot of money is being channeled into this particular COVID fund from the World Bank, from other world bodies, from the corporate world here. Ideally, what should we see? Where should most of the spending go?
I think, as the president mentioned in his speech on Friday, was it Saturday, that part of it is attributed to the fact that, yes, all systems went up very early, the curfew and everything else helped. For that reason, we expected to be at 10,000, but we had much less than that. And part of that credit must go to health workers and the Ministry of Health. I'm prepared to concede that. What I still think is a big, big problem that tells me that all these tea and snacks that we are buying are probably misdirected funds is the fact that our testing capacity, which the which the statement today says is at 37,500, we are testing at 500. So basically we are only testing close to 1.5% of what our testing capacity is. We cannot then say that that capacity exists, and yet we are spending much, much more money on teas and snacks. Teas and snacks are probably required, but my thinking is that we are not spending money in what allows us to actually get a good grip about how far community transmission has gone to, because if that happens, then we'll be in really, really big trouble. So bringing the testing capacity to its full capability very quickly, in my view, is the priority at this moment, together with hiring, of course. As we said, there's some money that's going into kitting up Kenyatta National, the hospital in Kenyatta University, and adding capacity at Mbagathi, some 300 million here and 500 million on the other side. I think, in my view, those are the priority areas.
Yes. Kwame, quickly, I know I don't have too much time. This figure is coming in at a time when the government said, we are misreporting. It emerged that they said that we'd used up 40 billion. Then the government comes in and said, no, we didn't use 40 billion. And now they start breaking down the numbers for us, as opposed to, no, we should be having this from the word go. In terms of transparency, going forward, what should we expect? What would you expect to see from the government?
Well, in my view, I think part of the statements that come in every week announcing what the caseload is, I think it should come with what the expenditures are. So even if it's not on a daily basis, but at the end of the week we should, because I think what the cabinet secretary stated was that 40 billion was what was dedicated, and some of that money was going to be spent in this budget year, and the others would be spent in the future. So, for instance, there's 1 billion that the government has dedicated but it's to be utilized up to June, and that came in as part of the supplementary budgets. So, clarity here, and I would not blame the media if we're explaining the health situation well, but not explaining the budgets that go with it, so that people can put those two together, then this kind of misreporting could occur. And you blame the press when actually, I think communication, it's important. People are interested in finding out how the money is being spent because it's public cash. So they need to be as keen on explaining to us how that money is spent, including units. Because I certainly do not believe that for over 48 days, it's reasonable to spend 3 million shillings per ambulance. It's too much.
Thank you very much, Kwame Owino, for joining us tonight. Really, really appreciate your presence here on KTN Prime. Kwame Owino, CEO, Institute of Economic Affairs, an economist, of course. And it's a conversation we'll keep having, even as we ask for more transparency from the government as far as the funds that are being spent so far on the COVID-19 response are concerned. A lot of reactions we are getting from a lot of Kenyans, so it's a conversation we'll continue having. Remember, our big Q tonight still is on matters education. Should we postpone? Should the government consider postponing the national examinations? Our Shadrach Miti has a report prepared on some of the disadvantages, especially for those coming